Hi, I'm Jessica.
Hi, I'm Jack. Welcome to my crib. Come here, baby.
I'm not on birth control. Shall we get the morning after pill?
Don't worry, babe, everything's going to be okay.
I'm not on birth control. Shall we get the morning after pill?
Don't worry, babe, everything's going to be okay.
No. I'm going to have it just in case. Hi, I'm Jessica.
Hi. I'm John.
Now, that was a very thought-provoking video. Unfortunately, situations like this can happen, but it's important to know what are the options available to you if you're faced in a similar situation. My name is Dr. Kareer from Let's Talk GP, and for the remainder of the video, I'd just like to talk to you about the emergency contraception options available to you if you're in the United Kingdom. The most common places to access emergency contraception are your local pharmacy or your chemist. It could be your GP practice or even your local sexual health clinic. These are the most common places where you would be able to access emergency contraception. Now, of course, there are other ways, other places where you can get emergency contraception, but the previously mentioned places are generally the most common. The three methods of emergency contraception available in the UK are copper coil, LO1, which is also known as the morning after pill, and it comes as a 30 milligram tablet, or thirdly, the levonorgestrel tablet, which comes as a 1.5 milligram tablet. It's interesting to mention that sperm can live in the female genital tract for 5 days. So if ovulation happens during this period, then there are risks for pregnancy. So now that you know there are three options available to you to choose from, how are you going to choose the right one? Well, it all comes down to where you are in your cycle. Ovulation happens usually on day 14 of a regular 28-day cycle, and there are ways to calculate your day of ovulation. Now, if you are after ovulation in your cycle, then tablets are not going to be effective. If you are prior to ovulation, then you can consider taking tablets. If you haven't yet ovulated, then all three options are available to you, and if you continue to watch the video, we'll take you through these options in more detail. So the copper coil comes in various shapes and sizes. It's essentially a piece of metal, as the name suggests, copper, attached to a piece of plastic, and then that's basically inserted into the womb. Now, because it needs to be inserted, clearly that requires a specialist, and quite often this would be done by either a specialist GP, or this could be done by a gynecology clinic, or even your local sexual health clinic. This would mean, obviously, approaching a healthcare professional, and understandably, this is less popular. And it basically works by damaging sperm and also the egg, so reducing the motility, the movement, and also the transport of the egg. But it also causes a local irritation to the womb, so preventing implantation into the womb, and obviously reducing the risk of pregnancy. So you're allowed to insert the IUD within 5 days after unprotected sexual intercourse, or within 5 days of ovulation, whichever comes later in the lady's cycle. So remember, if you do opt for the copper coil, it can also be used as a more long-term option for contraception, because whilst it's effective at emergency contraception, it's also an effective method without giving the body extra hormones at preventing pregnancy. So the morning after pill, also known as LO1 or ulipristal acetate, basically suppresses ovulation. So it suppresses ovulation and essentially delays the release of the egg up to 5 days. Now, because it delays ovulation, it still means that ovulation will happen, but it just delays ovulation. So that means that there still is a theoretical risk of pregnancy if the female were to have sexual intercourse unprotected at a later point in the cycle. And you're allowed to use this medication within 5 days of unprotected sexual intercourse. Now, remember, importantly, this is if you haven't ovulated. So remember where you are in your cycle. If you've not ovulated or you're getting close to ovulation, this method would be effective. So the third option is levonorgestrel. So remember, if you've not ovulated and you've had unprotected sexual intercourse, this is also another option available to you. But this method is only effective up to 72 hours, which is 3 days after unprotected sexual intercourse. And it also works in a similar fashion, delaying or inhibiting, preventing essentially ovulation. The other thing to be aware of with levonorgestrel is that if you weigh more than 70 kilograms or your BMI is more than 26, then the effectiveness of this medication can be reduced. The other scenario may be if you're taking certain medications, but this is also applicable to LO1 because certain medicines can impact the liver and that basically could affect the tablet. So to summarize this very short video today for you, there are 3 forms of emergency contraception available in the UK. There are advantages and disadvantages of each type, and it's worth discussing these with your healthcare professional at the time that you need these. Also, bear in mind though that whilst this video is about emergency contraception, having a more regular form of contraception would actually prevent you from being in this situation in the first place. So finally, if you found this video useful, please hit the like and subscribe button and share it with someone who might need to hear this message without obviously offending them.
Hi, I'm Jessica.
Hi. I'm John.